Have you ever heard someone say, better safe than sorry when it comes to medical tests? We often assume more medical tests means better health. In reality, skipping important checks after 60, like colonoscopies or blood pressure exams, can let cancers and hypertension go undetected, sometimes leading to strokes or emergency surgeries. But there's a flip side. After age 70, some routine medical tests can do more harm than good. In fact, the American College of Radiology explicitly says whole body CT should not be considered as a screening tool for people without symptoms. Today we'll cover 5 common tests doctors now advise older adults to skip and explain why each can increase your risk of cancer, anxiety, or unnecessary treatment. One of them actually causes 5% of all cancer cases in the USA, which is equal to the number of cases caused by drinking alcohol every day. Take the story of Dr. Kazuo Hida, a Japanese radiologist who warned in a 2023 Tokyo Health Symposium that testing without reason is no longer preventive. It becomes intrusive. He explained that older adults have a lower ability to recover from invasive procedures, making unnecessary testing potentially dangerous. Before we jump in, please like and subscribe to the YouTube channel Elevate Health, and tell me your age and where you're watching from in the comments. Your feedback helps me tailor content to our community. All right, let's get started. Number 1. Routine full-body CT scans. It might seem thorough to get a full-body CT scan, but experts strongly advise against it for healthy seniors. The American College of Radiology explicitly says, whole-body CT should not be considered as a screening tool for people without symptoms. These scans often spot tiny findings that aren't actually dangerous, but which lead to stress, extra tests, or even surgery that turn out to be unnecessary. They also expose you to significant radiation. Even one head-to-toe scan adds risk. One study estimated a single full-body CT at age 45 gives about a 0.08% extra chance of dying from cancer. Many scans use contrast dye, which can injure the kidneys. In fact, radiology experts say whole-body CT should not be used indiscriminately because of kidney risks and long-term radiation cancer. In practical terms, that radiation risk adds up. A person who starts yearly full-body CTs at 45 and continues for 30 years might face about a 1.9% lifetime cancer risk, and scans almost always turn up something. In one survey of 1,192 people getting whole-body CTs, 86% had at least one abnormal result, even though almost all those findings were later judged harmless. Even so, 37% of patients were told to get further testing. A Japanese study similarly found incidental issues on 40% of whole-body CT scans. Most of those proved harmless, but they led to more imaging, or even biopsies. After 70, the downsides of radiation, anxiety, and needless procedures far outweigh any benefit from a routine full-body CT. Number 2. Bone density scans when done too often. Bone density tests, also known as DEXA scans, are valuable when used correctly. They help identify osteoporosis, a condition where bones become fragile and more likely to break. But here's the problem. Many adults over 70 are getting these scans too frequently, or when they don't need them at all. According to the U.S. Preventive Services Task Force, bone density screening is recommended for women 65 and older, but repeating the test every year or two offers little benefit. A 2012 study in the New England Journal of Medicine followed nearly 5,000 women and found that bone loss progresses so slowly in most older adults that retesting every 5 to 10 years is sufficient. Repeating DEXA scans too often not only adds unnecessary radiation exposure, though minimal per test, but also leads to overdiagnosis. Many people end up being labeled osteopenic, a term for mildly low bone density, and are prescribed medications. They don't need drugs like bisphosphonates that can cause jaw necrosis, heartburn, and even atypical fractures when overused. Japanese geriatric expert Dr. Hiroshi Tanaka from Tokyo University Hospital cautions that bone density should be evaluated based on fracture history and overall frailty, not on a single scan result. He notes that age-related muscle loss and balance issues contribute more to fractures than mild osteopenia itself. meaning focusing on strength training, vitamin D, calcium, and fall prevention is far more effective than chasing scan numbers. A 2020 meta-analysis in Osteoporosis International also concluded that excessive testing causes unnecessary anxiety, false alarms, and overtreatment, particularly in those over 75. For most seniors, lifestyle improvements offer greater benefits than frequent scans. So unless you've had a recent fracture, are taking steroids, or your doctor specifically suspects rapid bone loss, avoid repeating DEXA scans too often. Use your medical history as a guide, not the calendar. Number 3, routine chest x-rays. For many older adults, getting an annual chest x-ray just to check feels like a good safety habit. But the truth is, for healthy people without symptoms, routine chest x-rays do more harm than good. The U.S. National Cancer Institute and the Japanese Radiological Society both agree that these scans should not be used to screen for lung cancer or other diseases unless symptoms are present. Here's why. The radiation dose from a single X-ray is small, but repeated over years, it adds up. And false positives findings that look suspicious but are harmless are extremely common. One large Japanese study published in the Journal of Radiological Protection in 2022 found that over 30% of routine chest X-rays led to follow-up CT scans or biopsies, most of which revealed benign conditions like old scarring or minor infections. Each unnecessary test exposes the body to more radiation, more stress, and in some cases, surgical complications. Dr. Keiko Matsuda, a lung specialist from Kyoto University, explains that the biggest danger of unnecessary imaging is the cascade of interventions it triggers. In other words, one small harmless shadow can lead to a chain of anxiety, invasive tests, and even operations that never needed to happen. Research from the UK medical journal Thorax also found no improvement in long-term survival from routine chest X-rays in healthy older adults. The tests didn't detect treatable cancers earlier than standard medical care. Instead, they detected too many harmless nodules that triggered anxiety and costly procedures. So if you're breathing fine and have no persistent cough, skip the routine chest X-rays. Focus instead on regular physical exams and honest conversations with your doctor about symptoms. Prevention works better when it's guided by real need, not habit. Number 4, brain MRI scans without symptoms. It's natural to worry about memory lapses or occasional confusion as we age. Many people over 70 ask their doctors for a brain MRI just to be safe. But that decision can often create more fear than reassurance. A brain MRI is a powerful tool that captures incredible detail of brain tissue. But in older adults, those details often reveal normal aging changes that look concerning but aren't harmful. According to a 2021 study in the Journal of the American Geriatric Society, over 30% of MRIs in adults over 70 show what radiologists call incidental findings, small white spots, tiny cysts, or vascular changes. Most are harmless signs of aging, not disease, yet they often lead to more tests, anxiety, and sometimes unnecessary treatments. Dr. Masaru Takahashi, a neurologist at Kyoto University Hospital, warns that MRI results must always be interpreted in the context of symptoms. A picture without a story can mislead. In his clinical experience, many patients were frightened after being told they had abnormalities, only to learn later these were benign age-related changes. Another issue is cost and accessibility. MRI scans are expensive, and the waiting time for results can create anxiety. A 2020 paper in the Lancet Neurology also found that unnecessary brain imaging leads to overtreatment and false diagnoses, particularly in people being screened for dementia or stroke risk without any actual symptoms. The Japanese Society of Neurology now recommends brain imaging only when symptoms like severe headaches, seizures, or sudden cognitive decline appear. The group cautions that overuse of MRI scans adds little value for asymptomatic seniors and may actually lower quality of life through constant medical worry. Instead of routine brain scans, experts encourage focusing on proven brain health strategies, regular physical activity, balanced diet, sleep, social connection, and mental stimulation. Those habits have stronger evidence for preventing dementia than any imaging technology can offer. Number 5. Cardiac stress tests when you don't have symptoms. Heart health is a major concern as we age, and rightly so. But here's a surprising truth: if you're over 70 and have no chest pain, shortness of breath, or other warning signs, a cardiac stress test might do more harm than good. Stress tests are meant to detect blockages in the coronary arteries by monitoring how your heart performs under exertion. The problem is, as we age, arteries naturally stiffen and blood flow patterns change even in healthy people. These normal age-related changes can make stress tests appear abnormal, leading to a cascade of follow-up procedures that aren't needed. A 2018 report in JAMA Internal Medicine found that nearly 45% of stress tests in adults over 70 were inappropriate for people without symptoms or clear risk factors. And of those who went on to have further tests like angiography, only 10% had significant disease that required treatment. The rest were exposed to unnecessary radiation, contrast dyes, and even surgery. Dr. Kenji Watanabe, a cardiologist at Osaka Medical Center, emphasizes caution. We often see older adults referred for angioplasty after a false positive stress test. Many end up with stents that don't extend life expectancy, but do increase complications. According to the American Heart Association, the most effective screening for heart disease in older adults is still lifestyle-based controlling blood pressure, cholesterol, and diabetes through medication, diet, and exercise. Cardiac testing should only follow symptoms or significant changes in health status, not routine fear. A 2022 study published in Circulation Japan reinforced this message, showing that unnecessary stress testing among seniors increased hospitalization risk by 14% within a year due to follow-up procedures and anxiety-related issues. So if your heart feels fine, your doctor visits are regular, and you're managing your blood pressure, you likely don't need a stress test just to be sure. In many cases, reassurance can come from good habits, not more machines. Conclusion. Here's the truth. After 70, good medicine is not about doing more. It's about doing what matters most. Routine full-body CTS, frequent bone scans, unnecessary X-rays, brain MRIs, and cardiac stress tests may seem preventive, but in reality, they can create new risks of radiation exposure, kidney damage, stress, and even unnecessary surgeries. Modern research, including studies from the Lancet, JAMA, and leading Japanese experts like Dr. Kenji Watanabe and Dr. Masaru Takahashi, consistently shows that over-testing in older adults can harm more than help. Prevention should come from mindful care, not mechanical repetition. Instead of scanning what's working fine, nurture your body through better sleep, balanced food, daily movement, and emotional well-being. Those are the real shields against disease and decline. If you found this video helpful, please like, subscribe, and comment your age and country below. It helps YouTube know that our content is meaningful and worth sharing with more people. This video was made after long research. We can't include every study here, but we've linked them in the description for deeper reading. Take a moment to explore, because understanding your body is the best protection you have.